Thanks, everybody, for joining the call today. Today, we'll be hearing from Kenny Zhu, who is the president of Color Us United and serves as its primary spokesman. He has challenged Harvard University for discrimination against Asian Americans, has worked as the director for media outreach against California Proposition 16, and is the author of An Inconvenient Minority, which covers the Ivy League discrimination cases and the lasting consequences of diversity ideology. Today, he'll be discussing some unprecedented moves regarding DEI in the UNC Medical School. Kenny has been leading Color Us United's campaign to pressure the UNC Medical School on DEI issues. He'll provide a short presentation and we'll take questions at the end. I ask that everyone on the call please mute their line until we're ready for questions. Thanks so much, and now to you, Kenny.
Good afternoon, everybody, at least on the East Coast. I'm going to share my screen with you guys. We have a presentation prepared for you, and it will not disappoint. I'm here to talk about our victory at UNC Medical School. What is the victory? UNC's medical school had been implementing a DEI framework for a long time now, for the past 2 years since October 2020, when they introduced their task force to integrate social justice. From this task force, they implemented policies that included racial equity trainings that denigrated employees, Black-only fellowships, and second chance admissions to Black students, curricula and public statements disparaging merit and blaming racial disparities on unconscious bias. And we know at Color Us United and across the country that Americans don't care about the race of their doctor. They just want the most qualified doctor. So we should not be having trainings, curricula, preferences that try to distract doctors from the mission of performing the best care for their patients. Color Us United is an organization that I'm a president of that believes in a race-blind meritocratic society. So our primary goal is excellence in the medical profession, and that is why we stood against the DEI framework at UNC's medical school. In January of 2023, our organization, and by the way, if you're interested in any of the evidence for all of these things that we're doing, feel free to ask questions, and I'm happy to provide to you those sources. So in January of 2023, our organization began the campaign to end DEI policies that harm the training of high-quality doctors. And we wanted to pick UNC Medical School specifically to start our campaign to get the dean to renounce the task force to integrate social justice because of the following things. Because UNC Medical School is a public institution, they're beholden to the state legislature here, and North Carolina is a fairly red state. Also because we're based out of North Carolina, and allowed me to be in person lobbying, talking to the trustees of the medical school. But we really believe that UNC Medical School is just the start of something. If we were able to get UNC to renounce their DEI framework, we could go to any medical school in the country and say, follow UNC's lead, follow their leadership. So we really wanted to launch an intensive campaign to bring the dean of the medical school, Dean Wesley Burks, to renounce DEI ideology and their task force to integrate social justice. Because we believe that DEI distracts doctors from excellence and promotes people based on their immutable characteristics. In summary, and I'm going to go through the campaign to you guys and our strategy and how we executed it later. But in summary, after a 5-month campaign started on January 2023, UNC wrote a letter sent by their senior counsel stating that they were disengaging with the task force to integrate social justice on the 11th of May. This is the letter. It's right here for you guys. Also the source right there. As you can see in the letter, it says in the second paragraph, second sentence, while we remain committed to these important missions of serving and improving the health and well-being of North Carolinians, the recommendations of the task force to integrate social justice have not been operationalized, and the task force has concluded its work. There is no plan to implement the task force's recommendations now or in the future. Even if the recommendations were revisited in the future, further review and revision would be required. They walked back their task force. This is a victory. This is the task force to integrate social justice that they were having. It is now no longer on their website. They've cleaned it completely up. They will no longer abide by the principles of this framework, and we have successfully convinced UNC to abandon the DEI ideology that is present in this task force. And this was our goal from the very start. If you looked at our website at colorusunited.org and you scrolled to our initiative at UNC, our petition, which has over 5,000 signatures now in North Carolina, asks North Carolinians to sign the petition to compel Dean Wesley Birx, the leader of UNC Medical School, to denounce the task force to integrate social justice. UNC Medical School has now become the first medical school in the country to publicly reject their DEI framework without legislative interference. This is significant because this is one of the most prestigious medical schools in the country, and we know so many medical schools and institutions across the country have been embracing DEI. So their brand carries a lot of weight educationally and across the nation. Furthermore, there's already been national interest surrounding the university because of their participation in the Students for Fair Admissions versus Harvard and Students for Fair Admissions versus UNC Chapel Hill case. That case specifically deals with DEI, specifically the race preferences in admissions. We were able to get UNC Medical School to renounce the DEI framework without even the Supreme Court interfering. How did we do it? What was our strategy to compel UNC Medical School to become the first medical institution to publicly renounce their DEI framework? By the way, we checked with the Foundation for Individual Rights in Education, and they have confirmed with us that they are the first medical school to do such a thing. We started the campaign in January of 2023. And in May of 2023, we got the result that we wanted. We got UNC to revoke the task force to integrate social justice. We spent about $100,000, mostly in ads and lobbying. And we identified 4 pressure points at the start of the campaign that we really wanted to target to make sure that UNC would have no recourse but to denounce and reject this unpopular framework. Think about the airplane and how people rush to the exits. We made sure to talk to the Board of Trustees, alumni, legislatures, and the general public. Those are our 4 pressure points. With regards to the general public, our strategy was to inform the North Carolina public through a social media petition campaign that UNC was using taxpayer dollars to support social activism at the expense of quality training, which is true. We give $697 million to UNC Medical School in taxpayer funding every year so that they can teach their kids that racism is the cause of health disparities instead of teaching their kids how to solve a kidney disorder. Our petitions on social media went viral, and they received over 5,000 signatures on our website from North Carolinians and brought greater attention to the issues of DEI in medicine. So we were able to successfully lobby the public. In addition, we supported bills in the state legislature to prohibit DEI statements and ensure racial admissions transparency. Those bills are still in the legislature right now, and we hope to pass them. But the secondary purpose of those bills was to expose to greater attention in the state legislature, who you remember has control over UNC's funding and governance, to expose these DEI issues and make it a point of leverage that the state legislature could use, a primarily, a legislature that is sympathetic to us, to use it as leverage. And they were able to do that. In fact, we were able to get a few legislators, including Representative Hardister, to write letters to UNC that demanded clarification on these DEI policies. Are you compelling speech? Are you compelling DEI statements in tenure, promotion, and hiring? are you lowering your standards in admissions for certain groups, which they are, and they have been doing. And because of this, UNC really felt the heat from some of their stakeholders. In fact, the Senate, the Senate of North Carolina had a in their budget for UNC, did not allot $36 million to the Keenan Flagler Business School, in part because of what we speculate as the DEI initiatives that they were pursuing. So we were able to exercise influence in the state legislature. Furthermore, we made an appeal to alumni and donors. What we know is that alumni and donors at UNC are very plugged in to the national news and to the local news. So we went and we published media articles and went on television to communicate that UNC Medical School's policies will result in lower quality doctors and harm free speech. Those are our two messages, and it worked. Because we all know that teaching people to become socially trained activists at the expense of high quality doctors will lead to lower quality care. We were able to publish these articles in diverse range of outlets and talk radio. I want to mention now the importance of FIRE stepping in to threaten their green light rating, because the green light rating from FIRE at UNC Chapel Hill is very important to a significant subset of the alumni and donors of Chapel Hill. And we were thankful to FIRE that they were the straw that broke the camel's back, for lack of a better word. They were the ones who came in and suggested, revising the task force to integrate social justice that led to this letter. It is at this point that I want to introduce some of the organizations that we collaborated with to make this campaign bigger than just us. And we're really grateful for their collaborations because they both contributed significant resources and exposure for some of the things that we were able to accomplish with this campaign. The first is Do No Harm, and the second is the James Martin Center for Academic Renewal. Both representatives are here today, and Do No Harm was the organization that really gave us the 89 DEI recommendations that the American Association for Medical Colleges asked UNC's medical school to implement. UNC said that they would commit to 82 of them. I would love to have Dr. Stanley Goldfarb now speak for just a couple of minutes on their campaign and what they were doing with that. Is Dr. Goldfarb here? Okay, Dr. Goldfarb is not here. That is fine. You can reach out to him. He supports our campaign. I also wanted to bring in the president of the James Martin Center for Academic Renewal. They're instrumental at providing some timely information to the UNC System Board of Governors, which oversees the entire public university system of North Carolina. They're instrumental at assisting the Board of Governors to make the correct decision on February 21st to prohibit the use of compelled speech statements in tenure, promotion, and hiring. I would love for Jenna Robinson to speak to that and anything else that she might want to speak to.
Thank you, Kenny. This is extremely exciting news. Congratulations to Color Us United on this major victory. I want to recognize just all of the partners who have made this happen. I want to recognize, John Seiler of the National Association of Scholars, who was the first person to blow the whistle on this task force report back in 2021. He did that on the Martin Center's website, and it kind of got the ball rolling. But without Color Us United's continued advocacy, we wouldn't be where we are today. I also want to, of course, recognize Do No Harm Medicine for the advocacy they have done, FIRE and the UNC Alumni Free Speech Alliance for writing letters to the medical school and to Dean Wesley Burks to ask him to do what Color Us United had also asked, to rescind the task force report, as well as the UNC Board of Governors for their excellent policy on compelled speech, and the UNC Board of Trustees for their policies on compelled speech and on institutional neutrality. I think all of those policies made it clear to the medical school that university leadership wants free speech, wants institutional neutrality on campus, does not want ideological doctrination to be the policy of the medical school. And so those board policies from the Board of Governors and the Board of Trustees made it clear to the medical school that they needed to take action on this. And so I think that partnership, our partnership and this success shows that vigilant and principled opposition to ideological indoctrination and to anti-meritocratic norms can work. We've seen the success today. So, thank you to everyone involved. Thank you, Kenny, for everything you've done. I'll hand it back over to you.
Thank you so much, Jenna. Vigilant and principled opposition is exactly right. In addition, we were able to really successfully and strategically target pressure centers. And that was the key. This is why UNC is the first. They won't be the last, but this is why they're the first, because we were able to exercise that opposition in a strategic manner, targeting key stakeholders. And I wanted to close off the strategy portion by talking about our work with the Board of Trustees. We have plans to present to the Board of Trustees of UNC Chapel Hill about the med school practices at their July board meeting. So that is another point of leverage that we were able to exercise, talking to the Board of Trustees members, soliciting hundreds of UNC doctors and staff and faculty about their experiences with DEI. Of course, we got a lot of feedback from that, a lot of anonymous feedback that we were able to get a few to talk to the Board of Trustees and share their concerns, and the Board of Trustees listened. So we're very thankful to the Board of Trustees for their listening partnership in that. We also obtained and exposed private files from UNC staff, such as emails that belittled the concept of merit. Think about that. There was a surgeon in California who presented and said, basically, we should be promoting doctors on the basis of merit. And there were several UNC deans of diversity, equity, and inclusion that decided that this was just, this was something that they needed to respond to in a system-wide email. So they sent a system-wide email belittling this doctor and saying he was not preaching inclusion. So they were using their system-wide emails and DEI authority to explicitly support political objectives. This is wrong. This is wrong. You should not use that authority to support political objectives. And so by sharing these concerns of doctors to the Board of Trustees, getting the meetings, getting that leverage, we really made UNC Medical School feel the heat from its own stakeholders. We're not done yet. I just want to let you guys know, however, we are not done yet. Yes, they publicly revoked the task force to integrate social justice. This is great. But there remain faculty and staff in that over that oppose our mission, who want to hire and promote according to their preferential ideologies, mind guard their employees in the name of inclusion. What we need to do is we need to monitor and solidify the implementation of this reversal. We need to continue to make sure that the DEI framework is not used to abuse their employees and to make sure to produce the excellent quality doctors that we know that North Carolinians want and deserve. So our next effort at UNC Chapel Hill will be to send an email to employees explaining the new precedent set by the reversal on the DEI statements and asking them to report to us unconscious bias trainings, racial preferences, curricula that they are based in divisive unconscious bias and critical race theory, and the divisive political statements that were made from faculty. Of course, we already have context inside the medical school, but this, I believe, will serve to embolden more people to be more vigilant, because this is a real precedent. In addition, we will be unveiling an alternative framework that we want UNC to adopt called MEDS. And one reason why we're doing this is because, yes, you can renounce DEI, but I get it. You want to provide fairness in care. You want to provide excellent care. How do you do that? Adopt a solidified framework that shows people the direction to go. And the direction to go is MEDS, merit, equality of opportunity, diversity of thought, and straight talk. This is our medical framework, our medical alternative to DEI. Number one, hire and promote solely on the basis of merit, because we all know that Americans do not want doctors of a certain race. They want the highest quality doctor. Number two, equality of opportunity. Treat people in a non-discriminatory manner, but don't expect equal outcomes like equity does. That is an unfair burden on doctors. We know that people are different, have different behaviors, life choices, and family situations. We should not be expecting equal outcomes. Thirdly, diversity of thought. Diversity not in skin color only. What's the use of diversity if everybody with different skin colors all believes and thinks the same way? Promote true diversity by enshrining diversity of thought and allowing doctors to debate and discuss with each other about what the real problems that are at the heart of their patients and conditions in the health system are. That is how you foster true excellence in medicine. Finally, straight talk. Allow doctors to be frank and straightforward with their patients. Don't censor them with racial equity trainings that tell them you have to say or believe or say a certain way about a person's patient or colleague. We believe that the implementation of the MEDS framework, merit, equality of opportunity, diversity of thought, and straight talk will inspire employees towards excellence and will lead to a less divisive culture. And we believe that UNC can be the leader, the national leader. Imagine UNC being a national leader in something that isn't basketball. They can be a national leader in challenging, not just challenging DEI, but promoting true excellence and meritocracy that all Americans believe. That is my charge to you right now, UNC leaders. And I know that you have the capability to do it because you've already done it with this stunning reversal of your DEI framework. In addition, we will be going to the next 10 schools, medical schools that continue to house divisive DEI frameworks, and we will be going after them too. We will be sending emails to Harvard Medical, Johns Hopkins, Perelman, Langone, Stanford, Columbia. These top prestigious medical schools that many Americans want to see the end of DEI policies too, we will go after as well. And now we have something to say to them. We can say UNC has stopped their DEI framework because they know how divisive and anti-meritocratic it is. What are you going to do? That is our next step. In conclusion, Color Us United, our organization is committed to the mission of a race-blind, meritocratic society where people are not judged on the basis of skin color, but on their contributions. Think about that. That's the vision for what America can be. But if we want to continue to progress to that mission, we need to eliminate harmful, race-based, divisive, anti-meritocratic policies in the name of DEI in medical institutions. That is why we're doing this campaign. That is why we are proud of this success and the success of all of our collaborators. And that is why we are here. You can contact me, Kenny Hsu, KXU at Color Us United. If you want this slide, we can certainly send it to you, as well as any conversations or interviews that you'd like to have. But we are totally committed to this, and we're excited to progress in this campaign. Thank you.
Thank you, Kenny. Are there any questions from participants on the call? Please.
Kenny, I have a follow-up question for you.
Sure. Yeah.
WREL put together a documentary called Critical Term, and one of the findings of that documentary, we spoke with healthcare professionals who essentially said that they had been taught in medical schools that Black women feel pain differently, and that affected the way that caregivers interacted with them in medical settings. And I think the most alarming finding was that in childcare or childbirth settings, Black mothers were dying at a rate 3 times that of white mothers. And so when you talk about eliminating or reporting racial preference in the way that healthcare is carried out, how would that not worsen the impacts that we're seeing there with the disparity in the racial impacts of during childbirth?
That said, and it goes directly to our equality of opportunity framework. We're trying to make this point with UNC leaders. If you look at the data on that framework, if you look at the data on the disparities in Black mortality, it can be traced to one thing. In fact, one factor fully explains why Black women have a higher mortality rate than white women, and it's gestational length. There's actually a 2021 study, which I'd be happy to send to you, that shows that Black women have more preterm pregnancies. They're also likelier to have behaviors that are associated with greater life stressors that lead to those preterm pregnancies. It's not based on the racism or on the unconscious bias of the doctors or on the racism of the health system. That's not the reason why Black women have a higher mortality rate. It's based on those other factors. And yeah, you could say, oh yeah, should we fix society to make it better for Black women so that they have fewer life stressors so that they can bring their baby to term better? Sure, but is that the job of the hospital system? No, it's not. Mr. Edelman?
Hi, I had a few questions. I hope that's okay. Looking at the links on the Color Us United website, it seems like UNC had 2 DEI task forces, one at the School of Medicine and one at the Department of Allied Health Sciences, which had a lot of overlap. Which task force was disbanded?
The Task Force to Integrate Social Justice, which is the medical school's task force. The medical school published this task force in October 2020. It was written with the help of UNC's medical school's director for DEI, Emmanuel Nathan Thomas III. And so it was the medical school's framework that they publicly rescinded. But because of this decision, I would imagine that these other frameworks would follow. In fact, if you look at our campaign landing page, there is an email that we exposed showing it was an email that was written from one of the DEI directors that said, please don't share this. And it was about the UNC Allied Health Sciences framework. They were concerned that if they exposed it to the public, it would get a lot of negative attention. And they were right.
So can you talk about the specific recommendations that were problematic that won't be going forward?
Yeah, so one of the recommendations was to require employees to sign DEI statements, tenure, promotion, and appointment. That's also in UNC's guidelines for appointment, tenure, and promotion, their APT statement. That was a policy eliminated by the Board of Governors decision on February 21st. That's something we oppose because it's using somebody's political beliefs as leverage against them or for them in the interview process. Nobody should be treated based on their political beliefs. Another thing is that they recommended holistic admissions, but as the Harvard case and this Chapel Hill case, as you guys may perhaps know, I've been heavily involved in those cases. As all of the data shows, holistic admissions is nothing but a veneer for the lowering of standards of Black applicants, right? What Black doctor would you want, going to med school, affirmatively admitted with lower standards? What kind of person do you have to be to really want to subject that person to the lowering of standards in medical school? That person should be treated just like everybody else in the admissions and promotion process. And that's something that we oppose. He should not be patronized. And that is something in the framework that we also wanted to fight against.
So are they now not doing unconscious bias awareness training or responding to microaggressions?
Well, that's what we're going to make sure of. Now that they have revoked the Task Force to Integrate Social Justice, which recommends racial equity trainings. And by the way, those have been done. Those are continued to be done. We're going to go after them and we're going to work with their own employees to make sure that these trainings don't happen again. So we're going to use their framework, their own framework that they've now rescinded, to tell them You have now done this. You're not allowed to do these racial equity trainings anymore.
Thank you.
Jason?
Hey, Kenny, do you
Hi.
think implicit bias exists in the medical field?
No, not systematically, no. Is
What
there
do you- how do you
prejudice
respond?
in this, is there prejudice in this world? Yeah, absolutely, there's prejudice. But there is nothing that you can say to doctors are being racist or having racial bias against their employees, their staff, or their patients.
I mean, there's a pretty extensive history of reports, studies that show that racial bias, in fact, does exist, particularly in the medical field. How do you respond to those studies?
Yeah, point it out for me. One thing that UNC did was an implicit awareness test. I'm sure you guys are familiar with the implicit awareness test, commissioned by Harvard University, projectimplicit.org. They tried to measure a person's quote unquote implicit bias. And 2 of the 3 authors of that initial implicit awareness test have publicly walked back their own recommendations. They publicly walked back the whole reason of the entire test. And the reason why is because if you take that implicit awareness test, by the way, many doctors did, it's completely useless. What they do is they flash 2 items on the screen and they ask you to associate it with a black face or a white face. And if you click on a black face faster, if it was associated with like poor, or a white face faster, if it was associated with rich, they would deem that as bias. And there was a time in the American legal system where people would actually use that implicit awareness test to ding people for being racist in legal cases. It's horrible. It's a horrible test. So it doesn't measure anything systematic. It's been rescinded, and it's not something that the UNC system should support. I just wanted to also say further on that point, we have talked with UNC doctors who were asked to take the test, also UNC medical students who were asked to take the test. And the question is why? Why are they asking you to take this test that has been devalidated, or that has been invalidated? And the answer is because they're trying. There are staff in there that believe that they can use this against you someday in your life. And I don't support that. I don't support using a implicit awareness test to try to ding the intentions of somebody.